Almost every patient who asks me about hormone therapy started the same way. Doc, I hear hormones are dangerous. And you know what surprises me is not the question, it's how old that fear actually is. If you were told this is normal, just aging, or something you have to live with, this is for you. So the main problem here is most people believe hormone therapy is dangerous because they were warned about hormone. But they were warned about a different treatment in a different era for a different patient. That fear never updated, but medicine did. And this is the clear truth. Modern bioidentical hormone therapy, when prescribed correctly and monitored, is far safer than most people believe and often safer than ignoring hormonal decline altogether. And this is why people misunderstand it. Early studies used synthetic hormones, not bioidentical. Doses were fixed, not individualized. Patients were poorly monitored, so results were generalized instead of personalized. So those conclusions stuck, even though the treatment changed. So what actually happened in real life? Today, bioidentical hormonal therapy means hormone identical to what your body already produces. Dosing based on labs, symptoms, and response, not average. Delivery methods chosen to reduce risk. Ongoing monitoring and adjustment. So, in real practice, most problem blamed on hormones come from wrong patient, wrong dose, or poor follow-up, not from the therapy itself. And this is the part most people never hear. Bioidentical hormonal therapy is not for everyone. First, active hormone sensitive cancer and control the clotting disorder, certain and treated medical condition. In those cases, hormones are not a solution. They are a variable that requires caution. And remember this. Safety in medicine is not about saying yes to everyone. It's about knowing when to say no. And most risk does not come from restoring deficient hormones. It comes from pushing levels beyond physiology. Restoration and optimization are not the same thing, and confusing the two is where problems start. Let me go through the most question asked that the patient will be wondering, and I'll try to make it clear answer. Is biohormonal treatment safe? Yes. When individualized and monitored, risk come from misuse, not from bioidentical hormones themselves. Does bioidentical hormonal therapy cause cancer? Hormones don't create cancer. They can influence existing biology, and the risk depends on type, timing, dose, and patient history. So, what about the side effects of this hormone? They are usually signal balance, not danger, and they are a feedback for us, and often they are reversible. Is testosterone safe for men and women? The answer is yes. when used appropriately and followed closely. The danger is overdosing, not and sometimes ignoring deficiency. Isn't this just anti-aging marketing? The answer is absolutely not. This is about restoring function, not chasing youth. Hormone therapy is not magic, and it's not for everyone. But assuming it's dangerous without context is just as irresponsible as assuming it's harmless. If you are experiencing persistent fatigue, brain fog, sleep disruption, mood change that doesn't feel like you, loss of libido or motivation, please do not self diagnose. Just get evaluated. And this is my bottom line. What should never be ignored is progressive decline being labeled as normal. Hit follow to help build momentum to fix healthcare in America. And let me know what you think because your feedback helps me sharpen the message.